All right, everyone, welcome to another edition of Chamber Chat. I'm your host, Jeff Griffin, president of the Peoria Area Chamber of Commerce. Our guest today is Dr. Kerry Head. Dr. Head, welcome.
Thank you.
So, Kerry and I, can I call you Kerry?
Yes,
We get through
absolutely.
that? All right. If you go to school to become a doctor, you deserve that respect, obviously, but always just cut through that and call you Kerry for now. Kerry is a doctor and owner of Illinois Vision Clinic out on North Knoxville and Pioneer Parkway, correct?
Right.
All right. And a new chamber member, so thank you for your support of the chamber and the community.
Absolutely. It's a great organization you have.
Yeah, thanks. How long have you guys been? You're relocating? We were talking briefly before we went on the air, but tell us about Illinois Vision Clinic.
Yeah, so I started that a number of years ago, approaching 17 years ago, and have had offices in Kewanee for coming up 17 years March, and then expanded a little satellite office in Morton, and then kids came along, and it's time to be closer to home, less time on the road, and so
Gotcha.
I'm opening an office here in Peoria to not have quite so many hours on the road.
Right.
So we've opened this new office and having a great new facility, beautiful new place to see patients here in Peoria, where I live.
Gotcha. Well, congratulations. Now, the other offices remain open, or you've consolidated?
That's correct.
Okay.
The other offices are still open.
Wow. So how many, with the other offices in the Peoria location, how many doctors and employees are there?
So we have 3, including myself in Morton, all part-time. We have 3 in Kewanee, if you count myself doing some time there, and myself in Peoria right now.
Gotcha. All right. Illinois Vision Clinic just opening up. You are open.
That's
and
right.
Taking patients. How do people connect with you if they want to be a new patient?
So we have a website that's up and in development still, and you can find us on Facebook. It's still going up and down at times, as that's also new and
Right.
in development. And certainly you can reach us right there by phone, right there on Knoxville and Peoria,
Gotcha.
Pioneer. And so we're reaching out and looking forward to
Right.
serving the Peoria area.
So that's what we're here to do. I mean, the power of Peoria Life is the online presence. That's why we love to interview our members and get the word out. So we'll make sure that Peoria Life and the Chamber share Illinois Vision Clinic, and you can push it out on your Facebook and get some new patients in there.
Yeah, thank you.
So you're originally from Illinois?
So I actually grew up in Oklahoma.
Okay.
Did my first 4 years school there in Oklahoma. 5 by the time I finished a microbiology degree. Or you might say I was a microbiologist before I was an optometrist. And then optometry school in Chicago led me to Illinois, and so my family is here, and I've stayed here. Hard to believe, but just had our 20-year reunion from optometry school in Chicago.
Okay. So what led you into, I mean, one of my college roommates, he had 2 brothers who were optometrists. They became optometrists because their father was an optometrist. It's kind of the line of succession. Somebody
Yeah.
to take over the practice, right?
Great.
But curious. How'd you
Yeah,
get
great
interested?
question. You know, I really think that it is actually curiosity that led me into the profession. My parents have always talked about the crazy curiosity, the things I did as a child. And I remember to this day, the very moment that just was in college, my first 6 weeks of school, and was walking up the steps, and I just hit me that optometry was kind of this great field where I could combine my medical interest, my cardiology interest, my biology background, and the physics and the sciences, and it just put everything in one place, and it was just a snap decision, never looked back, and have absolutely loved my profession. I think that's been the secret to my success. My patients ask me sometimes, I guess they actually state to me that you know, it shows that you love your profession, and that's true.
Right.
I just have been very happy with optometry, where we get to take care of medical or even just routine things. But my heart is in taking care of people's medical conditions with their eyes and helping them solve their mysteries in eye care, or helping them understand how there's so many ties to your eye health, to your other health.
Right. So see, this is interesting to me because I think sometimes optometrists kind of get a bad rap, right? As you're an optometrist, you're not necessarily a doctor. Because people, and I'm getting to a point here, but we grow up, I mean, at least when I grew up in grade school, you know, you go in, you see the nurse, you cover one eye, can you read the line? And then the whole idea of going to actually see a doctor for the health of your eye, right, is kind of an afterthought. But now I think, I mean, as opposed to when I was growing up, there's more focus on the pediatrics and getting kids in early for an eye exam.
Absolutely.
For doctor-sponsored eye exam.
Absolutely,
Correct?
and that is so true. Everything you're just saying, and while optometry was a profession that literally started with the jewelers of the U.S. And developed into hardware and equipment, but had evolved dramatically in the 70s, 80s, and 90s, and just taken off in the 2000s. And the technology that has just propelled our profession of what we can do. But yeah, so it is surprising. One of the conversations that comes to mind is one of my lead technicians who's been with me for years now tells the story how on her first weeks of training in the job, how she was like, why is he asking this question? And I don't remember what the question was, but we were talking about something that had to do with their vascular health, their blood, and their sleep history, and she was telling the story like, I had no clue where you were going with this.
Yeah.
But oftentimes people's sleep history, their blood history, like their cholesterol or vascular profile, or just their diet and nutrition, blood pressure, all these things play such a profound role in their eye health. And so we help patients put that together and understand.
Right.
Some patients may only want to come in for just, I'm going to get my glasses and go. But pediatrics particularly is so critical, where some reports, as many as 1 in 4 children will have concerns that slow them down in school.
Right.
But all these things just play such a dramatic role in their health that they may not have realized.
Right. It's more than just the old wives' tale. Make sure you eat your carrots and have good vision and so forth.
And optometrists today just do such a wide range of things. I know there is still the optometry of yesteryear, where it is very much still optical and glasses and things. And while we do that, I spend 85% of my time doing much more disease and pathology or prevention roles, and playing a role where we coordinate closely with the patient's physician to help understand or provide care.
Right. And see, that's the point I'm driving at, because having friends in the industry, I find it fascinating. So on the easy side of things, or on the low end service, somebody comes in, they can't see, suit them up for glasses, their eyes are healthy, boom, they can see the chalkboard.
Yeah.
But then on the extreme case, cataracts, cancers, what are some of the more extreme cases on that continuum of services or diagnosis, I guess?
Yeah, and that's what my techs talk about, how they love their job in our office, because they just never know where a day is going to take them. The eyes have a way of revealing everything from simple things like they may have the obvious cataracts, glaucoma, or retinal problems, but also can reveal serious disease. It's hard to find a systemic disease that doesn't manifest itself in the eyes at some point along it, the rollout of the disease. While some diseases are very helpful, that they may show up early in the eye, whereas some diseases may not show up until much later. So everything from brain tumors to just blood pressure to odd clotting disorders, or their tobacco history is showing that they may have a stroke, to showing MS. So it is literally all over the map.
It's imperative. People need to keep in mind, level set, folks. Jeff Griffin, Chamber Chat here on PeoriaLife.com. Our guest is Dr. Kerry Head, new office out on Pioneer Parkway in Knoxville.
Yes.
Illinois Vision Clinic. Look them up, get connected. We're talking about eye health and how it's more than just showing up periodically to get your eyes examined or making sure your kid's seeing the school nurse, who are great, the school nurses, we love you out there, but we also need to go and have routine eye exams like we go to see the dentist or our regular healthcare provider.
Yeah. I think one of the amazing things that people don't realize in the work or the setting is whether it's in school and they may see the chart at the doctor's office fine, they can still have significant optical needs that maybe they're farsighted. They may see the that test well at 20 distant feet and seeing far vision, but they're near, still struggling, and the symptoms just don't make sense.
Right, and you can help coordinate, diagnose, working, Kerry was talking about working with the primary care physician or the pediatrician for the patient's health.
Absolutely.
Right. So this being the Chamber of Commerce show, and obviously we love professionals opening new businesses in town, and the fact that you're not only a doctor, you're a business owner simultaneously. So there's some challenges with that.
Yes.
As opening a business, how do you balance that time between, because your passion's eyes, right? But you need an office to serve your patients.
It's a great question.
And
I am honestly much more of a doctor and in the medical sciences than I am a business type minded. You know, I didn't get an MBA or learn how to do spreadsheets in optometry school. And somewhat of an education guru, I still would enjoy reading my own journals of medical and science than I would a business journal.
Right.
So it is a difficult balance. So I try to turn those over to staff.
Right. Okay. And so that's driving to my point. We have a lot of folks out there, whether you're a optometrist or a cupcake maker or you have a passion, whatever your passion is, folks are passionate about their passion. Not most of us, no offense to the CPAs, are passionate about spreadsheets and crunching the numbers. You just want to go and serve patients.
Right.
So you work with, driving to a point of their employment opportunities or career path opportunities within your field that may not necessarily be becoming an optometrist. Are there staff within optometry, like dentists have dental hygienists? Is there a similar career within optometry?
We have certified technicians that have what we call ABO certified or COTs, and so we have a large range of staff from business to technicians. We're technician heavy as we take care of a lot of medical problems in our practice more than business, but increasingly finding that you have to strike that balance.
Absolutely. We had we're running out of time here, folks. I can't believe we're going to have you back, Kerry. But with our community colleges, for example, a lot of work we do is the Chamber of Commerce with Peoria Public Schools and making sure kids have career pathways.
Yeah.
And whether that's starting in the community college that turns into a stackable certification or not. So optometry is certainly a field or whatever, the health administration, the paperwork of the whole thing. There's career opportunities there.
Absolutely. And I find our technicians that get involved really tend to love what we do.
Yeah, that's important. I mean, because we're all supported by folks that keep the books and do that work and comfortable doing it, but they have to be also passionate about the mission of what they're doing.
Absolutely.
So you're opening this office as we close up. Dr. Kerry had Illinois Vision Clinic opening a new office out at Knoxville and Pioneer Parkway. And I don't know if we were talking on air, before air, you're opening this office because you live in Peoria. So you've been doing a lot of traveling to other communities.
I have.
Why do you love Peoria? Let's wrap up on a high note. You have an office closer to home now.
Yeah, so I love Peoria's. We've got great things to do here for the size of the city, the amount of activities you can do, and the cities that we have around us, and the connectivity of our airport. It's all fantastic.
You got it. Thanks for mentioning that airport. We love PIA. Thanks for all they do. Free parking, 24 hours a day, 7 days a week. So you could be a chamber president if the optometry thing doesn't work out. You're a good advocate for the community. So Kerry, thank you. Congratulations on the new office. And thank you guys for watching another edition of Chamber Chat here on PeoriaLife.com.
Thank you.
Yes, sir.
PeoriaLife.com